Today's topic, celiac disease. Celiac disease is an autoimmune disorder that's triggered when you eat gluten. It's also known as celiac sprue, nontropical sprue, or gluten-sensitive enteropathy. Gluten is a protein in wheat, barley, rye, and other grains. It's what makes dough elastic and gives bread its chewy texture. When someone with celiac disease eats something with gluten, their body overreacts to the protein and damages their villi, small finger-like projections found along the wall of their small intestine. When your villi are injured, your small intestine can't properly absorb nutrients from food. Eventually, this can lead to malnourishment, as well as loss of bone density, miscarriage, infertility, or even neurological diseases or certain cancers. If your celiac disease isn't better after at least a year without gluten, it's called refractory or non-responsive celiac disease. Most people with celiac disease never know that they have it. Researchers think that as few as 20% of people with the disease get the right diagnosis. The damage to your intestine is very slow, and symptoms are so varied that it can take years to get a diagnosis. Celiac disease isn't the same thing as gluten intolerance or gluten sensitivity. People with gluten intolerance may have some of the same symptoms and may want to avoid gluten. But they don't show an immune response or damage to the small intestine. Celiac disease symptoms. Celiac disease isn't the same thing as a food allergy, so the symptoms are different. If you're allergic to wheat but eat something with wheat in it, you may have itchy or watery eyes or a hard time breathing. Celiac disease symptoms in adults. If you have celiac disease and accidentally eat something with gluten in it, you may have symptoms including abdominal pain, anemia, bloating or a feeling of fullness, bone or joint pain, constipation, diarrhea, gas. Celiac disease can also cause a loss of bone density and reduced spleen function, hyposplenism. Celiac disease causes and risk factors. Research hasn't found a definite cause of celiac disease. It tends to run in families and might be linked to certain genes. Stressful medical events such as a viral infection or surgery can trigger it. So can emotional trauma or pregnancy. If one of your close family members has it, like a parent or sibling, you have a 1 in 10 chance of getting celiac disease.